السلام عليكم طلباتنا الأعزاء. محاضرتنا اليوم عن bad oral habits. By definition, habits is a fixed or constant practice established by frequent repetition. Bad habit can interfere with the child's physical, emotional, and social function. The etiological factor or agents in the development of bad oral habits are: number one, the anatomical factors. For example, posture of the tongue, infantile swallow occurs due to large tongue in a small oral cavity, occupied with anterior open bite of the gum pads. Number two, mechanical interferences. This lead to undesirable oral habits, such as when the permanent incisors is ectopically erupted or missed. This will lead to anterior tongue thrust to achieve the anterior oral seal. Number three, pathological. Certain condition of oral or periodontal structure can cause an undesirable oral habits. For example, tonsillitis, hypertrophy, or inferior nasal turbinates. And this may lead to mouth breathing habits. Number four, emotional upsets. Children regress toward infancy, assume infantile pressure or posture. Example, digit sucking, which gives child feeling of security. Number five, imitation young. Child are extremely observant and sensitive to environment and highly affected by the parents and siblings. The child might imitate jaw position and or speech disorders of parents. Number six, random behavior. The behavior appear purposeless, if not completely accidental. Now we will start with the most important type of habits in the child, which is the digit sucking habit, and include thumb and or finger sucking. The repeated and forceful sucking of thumb and or finger with associated strong buccal and lip contractions. Almost all children take up this habit, but eventually discontinue it spontaneously. With the age and maturation, there are essentially two forms of sucking. Number one, nutritive sucking. It is the sucking observed during breast and or bottle feeding, which provide nutrition for the infant. Number two, non-nutritive sucking. It is the earliest sucking habit adopted by the infant in response to frustration and to satisfy their need for contact. Children who neither receive breastfeeding nor have access to a pacifier may satisfy their need with habits like thumb sucking, which ensure a feeling of warmth and cause security, but may be harmful to their dentofacial development. The main effect of digit sucking: if these habits present beyond the time that the permanent teeth erupted, then it will cause the following effects. Number one, the extraoral effects. The offending digit is exceptionally clean, reddened, or sometimes deformed. Fibrous, roughened callus may be present on the digit, and sometimes there may be viral or fungal infection. Number two, the intraoral effects like proclination and spacing of the upper incisors, retroclination of the lower incisors, anterior open bite, usually asymmetrical, and this is depend on the side of digit used in the sucking habit, narrow maxillary arch and posterior crossbite, the severity of malocclusion caused by digit sucking habit depends on several factors. Number one, frequency. It means the number of times per day habit is practiced. Number two, the duration is the amount of time spent on habit. Number three, intensity is the amount of force applied to the teeth during sucking. How can diagnose the digit sucking? This depends on the history and extraoral examination and intraoral examination. Now, we will talk about the treatment of digit sucking. Number one, by discussion. The simplest approach to habit therapy is a straightforward discussion between the child and dentist that expresses concern and include an explanation by the dentist. This adult approach is often enough to terminate the habit, but is most effective with the older child. Number two, the reminder therapy. It is best suited for those patients who desire to stop the habit but need assistance to do so. It includes adhesive tapes, bandage to the offending digit, or distasteful liquid and or ointments like hot flavored, bitter tasting, or foul smelling preparation. This is placed on the thumb or finger that are sucked. Number three, reward system. If the reminder approach fails, a reward system can implement that provide a small tangible reward daily for not engaging in the habit. In some cases, a large reward must be negotiated for complete cessation of the habit. Number four, appliance therapy. Either removable appliance with the tongue grip or grade, or fixed appliance like God helix or maxillary lingual arch with the palatal grip. In general, if the child is younger than 3 years, no active intervention regardless of type of severity of malocclusion because of general emotional maturity. Most children outgrow the habit by 5 years of age, and malocclusion is self-correcting if ceased by the time of eruption of the permanent teeth. The patient should be at least 7 years old to receive the appliance therapy. To reason and understand the need of the appliance, always parent support and encouragement is necessary to help the child through the treatment period. When sucking ceases, appliance should be retained for approximately 3 months to ensure that the habit has truly stopped. The second type of habit is tongue thrusting habit. It is a condition in which the tongue protrudes between the anterior or posterior teeth during swallowing, with or without affecting tooth position. The classification of tongue thrusting, and this is depend on etiological classification. Number 1, physiological tongue thrusting. This comprises of normal tongue thrust swallow of infancy. Number 2, habitual tongue thrust. The tongue thrust is developed due to repeated placement of the tongue. Number 3, the functional or adaptive tongue thrust. The tongue thrust is an adaptive behavior developed to achieve an oral seal. Number 4, endogenous tongue thrust. The tongue thrust is due to neuromuscular mechanism. Number 5, anatomical tongue thrust. The tongue thrust is due to macroglossia or large-sized tongue. In a small proportion of subject, the swallowing activity is accompanied by another thrust of the tongue which appear to be basic neuromuscular mechanism. This so-called endogenous tongue thrust is sometimes associated with anterior lisp or sigmatism during speech. It usually affects the developing teeth to extent of preventing the full vertical development of the anterior dentoalveolar segment, so that an incomplete overbite or more usually anterior open bite will develop. Management of tongue thrusting. Number 1, if the child is between 3 and 11 years, this is considered as normal occurrence during this period. Not to be concerned and only assure the parents. If the child is under 7 years, there is no need to be concerned since speech sound that elect the lisp is not mature until 7 to 8 years of age. Only conservative approach is done and demonstrate correct swallow for the patient and observe the child between time and time. Number 2, if the child is 11 years or older, the tongue thrust during this period is not normal pattern and the treatment must be started. The option of a treatment may be number 1, correction of malocclusion, and this is done by fixed or removable appliance. Number 2, use of myofunctional therapy. Number 3, muscle exercisers. Muscle exercise is done by asking the patient to place the tip of his tongue in the rugy area for about 5 minutes and then swallow. And this process must be repeated for 4 or 5 times per day. Number 4, using of oral screen or habit-breaking appliances. We must know that the treatment of endogenous type of tongue thrusting has poor stability. Mouth breathing habit. It is a habitual respiration through the mouth instead of the nose. The main cause of mouth breathing habit are number 1, nasal obstruction, which may be due to hypertrophy of pharyngeal lymphoid tissue, and this is non-adenoid, or defects in the nasal septum, or polyps, or allergic rhinitis, and so on. Number 2, it may be also due to habitual mouth breathing when it continues even after the obstruction has been removed. The effect of mouth breathing habits. Number 1, adenoid facies. This appearance is characterized by long narrow face with underdeveloped paranasal area and small nostrils. Number two, increased facial height and long face. Number three, the mandible would rotate downward and backward. Number four, the posterior teeth would over-erupt. Number five, anterior open bite and increase overjet. Number six, posterior crossbite. This is accompanied by constricted maxilla with narrow-shaped palate. Number seven, incompetent lip and dry and fissured lips. Number eight, gingival hypertrophy. In addition to the clinical features, mouth breathing habit can be diagnosed by the following tests. Number one, ask the patient to take a deep breath. Most mouth breathers respond to this request by inspiring through the mouth without changing the size or shape of the external nares. Number two, mirror test. A double-sided mirror is held between the nose and the mouth. Fogging on the nasal side of the mirror indicate nasal breathing, while fogging on the oral side indicate mouth breathing. Number three, cotton test. It is called Masler butterfly test. In this method, a butterfly-shaped cotton stand is placed over the upper lip, below the nostrils. If the cotton flutters down, it is a sign of nasal breathing. This test can be used to determine a unilateral nasal blockage. Number four, water test. The patient is asked to fill the mouth with water and retain it for a period of time. The mouth breather finds this task is very difficult. Management. The EN test referral for the management of nasopharyngeal obstruction is very necessary before any orthodontic treatment. Sometimes myofunctional therapy and oral screen also can be used for the treatment of mouth breathing. The other type of bad oral habit is bruxism. It is the term used to indicate the non-functional contact of the teeth, which may include clenching, grinding, and tapping of the teeth. The main etiological factor are occlusal defect and psychological factor. It may cause occlusal wear, sensitivity, teeth mobility, fracture, and temporomandibular joint problems. How can we manage the bruxism? The management is started by number one, determine the underlying cause and eliminate it. Number two, occlusal adjustment, including restoration and occlusal splints or bite guards. Number three, psychotherapy like relaxation exercises. Number four, drugs like local anesthesia, injection to temporomandibular joint or muscle, and sedatives and muscle relaxation. Lip sucking and lip biting. Lip sucking may appear by itself or it may be seen with the thumb sucking or as compensatory activity that results from excessive overjet and relative difficulty of closing the lips properly during deglutition. In almost all instances, it is the lower lip that is involved in the sucking and biting, although biting habit of the upper lip are observed as well. When the lower lip is repeatedly held beneath the maxillary anterior teeth, the result is proclination of these teeth, often with open bite and sometimes retroclination of the mandibular incisors. Sometimes there may be eczematous appearance of the skin below the lower lip. How can we manage the lip sucking and lip biting? Number one, we can use lip over lip exercises. Number two, lip bumper. It could be fixed or removable with labial acrylic pads used to stop sucking or biting habits and eliminate the backward pressure of the lower lip on the lower labial dental segment. Number three, by the use of oral screen. Nail biting habit. It is one of the most common habits in the children and adults, which may be due to emotional and social problems that may affect the psychology of the individual. The clinical feature of the nail biting habits are number one, crowding of the teeth, number two, rotation, number three, attrition of the lower or upper incisors, number four, effect on nerves like inflammation of the nail beds and heavily cut nails. The management of nail biting habits include number one, no treatment in the mild cases. Number two, treat the basic emotional factor causing the habit. Number three, encourage outdoor activities. And number four, reminders like nail polish. Unreplaced missing teeth. Space unreplaced missing teeth may have an injurious effect on the teeth. Missing teeth can lead to drifting, tilting, and extrusion of teeth. This alteration in the position of the functional relationship of the teeth can result in increased plug formation, food impaction, soft deposit retention, malocclusion, and occlusal disharmonies. The other habit is filing of the teeth. Unfortunately, some people come to the dental clinic to cut their or file their teeth for aesthetic or cultural purposes. Whichever the reason, it must be discouraged and abolished completely. This is most seen in girls, young women, and in few cases, young boys. It is important to note that filing of the teeth can cause teeth sensitivity and damage to the pulp of the teeth, discoloration of the teeth, and toothache. Chewing of sharp or point objects. Chewing on object is also a bad habit, such as metal, pencil, pen, knife, needle, pipes, broken bottle, and so on. These are not part of the normal chewing function of the teeth. Chewing on sharp or pointed object can cause scratching of the teeth and damage of the soft tissue of the mouth. Opening bottles drink with teeth. It is very abnormal and bad oral habit to open a drink with teeth. This may cause scratching of the teeth, cracked teeth, fractured or broken teeth, the mobility of the teeth, or extraction. chewing hard substances. When we chew on hard substances, this will causing unknown harm to our teeth. Our teeth were made to eat the food and crush the food into smaller particles. They were not meant to chew on pen, caps, pencils, or any other hard materials. Wrong use of toothpicks. If you use a toothpick with the wrong way, then you will go on to cause a lot of damage to your gum, and you can even result from chipping and breaking of teeth. A toothpick needs to be used extremely gently in order to dislodge the food from the crevices of the teeth. Chewing ice. This will cause gum recede and even allow your teeth to crack. Really bad. The damage might be also bad that you will need to cap your teeth. Using a teeth as a pair of scissors. The teeth are meant for different things, but certainly not to work for you like a pair of scissors. Don't use them to tear or cut things that are meant for scissors. It should be avoided at all costs. Wrong use of the toothbrush. One of the main causes of loss of bone around the teeth or gums precision is an excessive rubbing of your teeth, which include brushing too vigorously from up and down or side to side, which cause increased sensitivity to touch and cold. Excessive consumption of drinks containing acid. Generally, people take excessive soda and acid containing drinks, like soft drink and so on. The sucking on lemon and excessive drink of juice can create much acid content to your teeth that can damage your teeth in various ways. It can cause many problems like worn and chalky looking of the enamel and relative sensitivity to cold drinks and foods. شكرا جزيلا. أتمنى أن تكون المحاضرة واضحة، وأنا مستعد للإجابة عن أي سؤال عن طريق الكلاس روم بأي وقت. شكرا جزيلا.